Whenever you're sitting in a doctor's office, have you ever stopped and wondered how they really know what's best for you? Well, today, we're going to pull back the curtain on that. We're diving deep into the science of making smart health decisions, from huge national policies all the way down to the care you get yourself.
I mean, really think about it. Is it just that they've been doing it for years? Is it some kind of gut feeling they've developed? Or is there something more scientific, more concrete going on? The answer to that question, well, it really gets to the very heart of how modern medicine and public health actually work.
And that something more has a name: the evidence-based approach. It's a really simple but powerful idea. It's all about shifting away from just opinion or, the way we've always done it, and instead making decisions based on hard, systematically collected proof of what actually works.
So, to really get our heads around this, we're going to go on a bit of a journey. We'll start with the huge, big picture stuff that makes a society healthy. Then we'll zoom into how countries decide what to focus on. We'll peek inside the doctor's playbook. Then we'll talk about how money changes everything. And finally, we'll face the tough gap between a perfect plan and the real world.
All right, let's get into it. First things first, to really start making sense of this, we have to look way beyond the four walls of a hospital or a clinic.
Because here's something that might surprise you. The biggest things that determine our health often have almost nothing to do with healthcare itself. We're talking about what experts call the intersectoral level. It's just a fancy way of saying all the other parts of society that actually shape how healthy we are. Just think about it for a second. The strength of a country's economy, how much money we make, our level of education, the quality of our food and water, even the environment around us, all of these are massive drivers of our health. So a truly evidence-based approach can't just focus on pills and procedures. It has to start here, with the big stuff.
Okay, so let's zoom in a little bit down to the national level. How does a whole country, with all those different factors at play, figure out where to spend its limited healthcare dollars? Well, here's where we hit a major challenge, because when you look at the evidence, you find that national health funding often doesn't line up with the diseases that are actually doing the most damage. Sometimes, other pressures can create this serious mismatch between where the money is flowing and what's actually causing the most death and disability.
So, how do we fix that? How do we get a clearer picture? A lot of it comes down to how you measure the problem. See, if you only count the years of life lost to a disease, you're only looking at one thing: death. But there's a much smarter metric called DALYs that looks at two things: death and the years people have to live with a disability. It gives you a much fuller, much more accurate picture of a disease's true impact. And this is where it gets really interesting. When analysts in the US compare National Institutes of Health funding to the disease burden measured in those dailies, they found some pretty startling gaps. Things like complications around childbirth and the lung disease COPD were way underfunded for the harm they cause. Meanwhile, other areas were relatively overfunded. Using better evidence, better data, suddenly reveals where our priorities might be out of whack. Okay, let's zoom in one last time, down to the level that we all know firsthand, the doctor's office. What's the evidence-based tool that they're using day to day? They're using these clinical guidelines. You can just think of them as the official playbook. They take these huge mountains of scientific studies and evidence and boil them all down into clear, actionable recommendations for doctors and, of course, for patients. But, and this is a big but, not all guidelines are the same. The old way of doing things was basically to get a bunch of senior experts in a room and have them come to a consensus. The problem with that? It can lead to wild variations in care depending on which expert you ask. The new, evidence-based way is way more rigorous. It relies on formal, systematic reviews of the actual scientific proof to create consistent, high-quality standards for everyone. So now we've got these great, evidence-based guidelines. We know what works. But in a world with limited budgets, that's just not enough. We also have to ask a tougher question. Is it worth the cost? And that brings us to this crucial idea of cost-effectiveness. To make this really concrete, let's look at a fascinating real-world example from the Netherlands. A group of experts there had to figure out a guideline for prescribing statins. Those super common but also pretty expensive cholesterol drugs. To make a rational, evidence-based decision, they did something kind of remarkable. They put a price on it. They all agreed that a treatment was worth it only if it cost no more than about $21,000 for every extra year of healthy life it gave a person. That number, that became their line in the sand. And just look at how that one single number creates a clear, easy-to-follow playbook. For a 40-year-old, for example,
Statins are only recommended if their 10-year risk of a heart attack is over 25%. If it's below that, the cost just isn't justified by the benefit. This is what evidence-based, cost-effective decision-making looks like in the real world.
But even if you have the world's most perfect, evidence-based, cost-effective guideline, there's one last giant hurdle to overcome, and that is the reality gap, because what works perfectly in a controlled scientific study doesn't always translate to the messy real world. This quote really says it all, doesn't it? There is a huge difference between the best possible result you can get in a perfect clinical trial, that's its efficacy, and the actual health benefits people see in their everyday lives, that's its effectiveness. So where does this gap even come from? Well, one study broke it down into 5 key hurdles. It's like a chain of events, and any single link can break. First, does the patient even get in to see a doctor? Is the diagnosis right? Is the right treatment prescribed? Is it delivered correctly? And then the big one, does the patient actually follow the plan? A failure at any one of those steps creates the gap.
And the size of this gap can be absolutely shocking. For diabetes, get this, an estimated half of all the people who need treatment haven't even seen a doctor about it. For depression, half of patients who were being treated were getting doses that were too low to even work properly. The best guideline in the world just can't fix these real-world problems all on its own.
So where do we go from here? Well, the trend seems to be a shift in responsibility, moving away from just top-down rules from the government. Instead, the focus is shifting to empowering the doctors and nurses on the front lines, giving them these evidence-based tools and the autonomy to deliver effective, valuable care for their patients. Which leaves us all with one final and really crucial question. These tools are incredibly powerful for making logical, rational decisions, but when we start putting an actual price tag on a year of life, who should get to make that call? Is it doctors, economists, politicians, or is that a conversation that we all need to have together? Now, that's a question that goes way beyond the data, right to the very heart of what we value as a society.